Hey, I'm Levi P, and this is what I learned in Issues with Aging. Designing environments in nursing homes. It's important to realize that nursing homes aren't just a shelter, that they're a space for healing, and these designs should be easy to navigate, with lots of color contrast to avoid confusion. There should be access to nature, such as gardens, which can evoke past memories that were once forgotten, and there should be spaces for both social and private life. Assisted living, assisted living, also called skilled nursing facilities. There's a set level of care, which is a step below the hospital. Nursing homes are allowing people to live longer, but not necessarily healthier, as there are still lots of chronic illnesses that occur in the elderly population. Cost is $6,000 to $7,000 a month because of the need for physical therapy and medication administration, along with assistance with everyday living. If a patient plateaus in recovery, they no longer qualify for Medicare coverage. And medication administration. If a patient refuses medication, you cannot force the patient to take their medication, even if this will result in them dying. Here's a picture of a nursing home. Notice that it doesn't look very institutional. It looks very homey. This is very important, as if you're living in a facility like this, you don't want to look like you're living in an institution. Medication and the elderly. There's many things that happen in an elder that increase drug concentration. The decline in renal functioning slows down the excretion of drugs. Decline in liver metabolism and decreased blood flow decrease the breakdown of drugs, and decline in lean body mass and increase in fat increases the half-life of lipophilic drugs. And elders often suffer from chronic illnesses, which means they have to take multiple medications. This picture probably looks familiar. A lot of elders have to take many prescriptions every day, which can be very confusing, and there's lots of drug-to-drug interactions that occur. Onto the Hmong. Hmong and healthcare. There are over 50,000 Hmong Americans living in Wisconsin, which is third most out of any state in the United States. It's important to realize that Hmong don't readily seek treatment for disease without acute symptoms present. Also, major health decisions are made with entire family and clan leader, which can cause major healthcare decisions to take weeks up to even months. So it's important to realize this as a healthcare provider, that you might not get a response as timely as you're used to. Falls and fall prevention. Falls are the leading cause of hospitalizations in ages 65 and older. Fear from falling affects lifestyle. Once an elder has fallen, they lose their independence because their fear creates a barrier for things that they want to do. The most common time that falls occur are at 11 a.m. and 5 p.m. This is because this is when they are preparing for meals, and there's lifting heavy equipment such as pots and pans. There's spills in the kitchen that they can slip on, and medications are starting to take effect. Here's an elder who has fallen. To prevent this from happening, here are some tips for elderly fall prevention. Work on strength, follow medication directions, check your eyesight, and be aware of environmental hazards. So to apply this information in the healthcare profession as a physical therapist, I will make sure to educate the elderly on Medicare rules so they take physical therapy seriously to make sure that they don't plateau and are no longer eligible for Medicare. I'll also use the information I learned in Hmong to realize that they have different beliefs, which affects healthcare practice. Make sure to look the patient in the eye when talking to them, not the translator. Also, to understand that yes doesn't always mean yes. It could simply mean that the Hmong is acknowledging that they heard your question and they respect that you asked a question. So try to avoid yes and no questions. Also, to understand that once elders have fallen, it creates a barrier on their life, and doing exercises and routines may be difficult, so make sure to have patience when working with them and to understand that things aren't as easy for them. And chronic illness and multiple medication effects in elders affects their mind and body, which can make simple tasks difficult that most people take for granted. So in conclusion, if you want to be like the people on your right, enjoying your independence and activities in your everyday life, realize that sometimes you have to do exercises like the picture on the left to maintain this independence. Thank you for listening. The end.